Welcome to On the Edge of Health and Design, the podcast where healthcare meets design, with your hosts, Nita and Sylvia.
Hi, everyone. It's your co-host, Nita, here. And welcome to the May episode of our podcast. Now, we were supposed to have a guest to interview for the month of May, but there was an unforeseen circumstance and they were unable to make it. I did not think that I would post a podcast episode for May, but at the same time, I'm someone who pretty much follows through on a lot of things. So to not have a May episode kind of bothered me. And so I thought, let me just talk about something related to health and design, something personal. And I decided to talk about shift work. So believe it or not, I've been in healthcare a long time, something over 2 decades, and I have never worked a full night shift. Consider myself lucky, right? Well, I've been on call in the hospital as a pharmacist many moons ago, and that experience was fine. I'm a super light sleeper, so if you wake me up at night and you ask me like a technical question, I could probably give you an answer or spend some time looking it up and then give you an answer. But working all night for 7 nights in a row was something that I was definitely not prepared for, and definitely up there in terms of life challenges that I've endured, not just, in my professional life, but also in my, personal and health life. It's definitely physically challenging more than anything. And when I was thinking about talking to you about this, I decided let me do some research, like internet research, I mean. And I came across the Institute for Work and Health, which is a nonprofit organization, kind of like a think tank. They do their own research, they do knowledge translation of existing research. And when I looked up night shifts or shift work on their website, I found a lot of interesting information. I'm going to share a little bit of that with y'all. So people who work night shifts, no surprise, they have crappy sleep compared to people who work day shifts. And I definitely experienced this firsthand. I'm not a good daytime sleeper, even when medicated. I tried a sleep aid, and I don't endorse sleep aids on a regular basis, but I kind of thought that I probably was going to need something. And ironically, the sleep aid worked for me at night, but it did not work for me in the day. I got something like 2 to 4 hours of sleep that week. It was not great. And then over time, this effect on sleep can have some consequences on health. So we're talking long term, like people who do night shifts, say for 20 to 30 years. And a lot of the studies are actually on nurses that do these types of shifts. And there is some evidence that doing these shifts on a regular long-term basis can be associated with increased risk of certain diseases like heart disease, certain types of cancer, gastrointestinal problems, and mental health issues. And night shift workers are also at increased risk of workplace injury, depending, I guess, where they work compared to day shift workers. But there are things that can help to mitigate night shift, because sometimes night shift is inevitable. Like you kind of have to do it if you work in something like a 24/7 hospital. Well, limiting the number of shifts in a row is supposed to help. So doing ideally no more than 3 night shifts in a row. I thought that number was kind of small. I was kind of surprised about that, but that's what the literature shows according to the Institute for Work and Health. And then I also came across some recommendations on the Canadian Centre for Occupational Health and Safety. And they talked about mitigating factors being not just at an organizational level, like what can the organization do to make the sort of facilities or environment more conducive to night work. So for example, having rest facilities, exercise facilities, having breaks involving staff in determining their night shift schedules. And kind of all of these things are pretty much incorporated where I work. So that's kind of a good thing. But then there's also the whole individual factors, like how can you yourself design your life so that you're sort of able to put your best foot forward, say, for night shifts. And I tried to do this. I tried to prep before I went into the night shift. I did my own research, if you will, asking colleagues who'd been through this before, what do you do to prep for night shifts? So some of them told me, well, I stay up all night the night before so that I kind of start to get my body into that circadian rhythm. And other people told me that they start to stay up like 2 nights before, 3 nights before. And then still other people told me they don't do this at all and they just like go into it and they know that the first night is going to be really crappy, but then subsequent nights might improve. And then there were recommendations on caffeine, the timing of it. Some people wanted to take it at the start of the shift, some people taking it at midnight. And recommendations around food, like snacking all night versus having a meal around midnight. So I tested all of these things pretty much in the week of night shifts. I had a lot of different options in terms of testing. I tried to stay up later about 2 to 3 nights before, but I couldn't quite make it all night. And that probably is a function of me being a morning person and just not able to stay up so late. But then sort of tested the caffeine hypothesis and kind of landed on having it at the start of the shift, which tended to last me for a long time because I'm generally sensitive to caffeine, maybe compared to people who have a lot more caffeine during the day. And then the food thing, my stomach didn't know what hit it the first couple nights. It was like, am I really digesting it at this time? But then after a couple nights, you kind of get used to eating at night. And you get hungry and unexpectedly because you're working, like you're fielding calls and you're doing things, and so you're using up that energy and you gotta fuel yourself. So it definitely is very challenging to design your life around working nights from sort of a health perspective, but also from a social interaction perspective, right? And that's been shown in the literature as well, according to Institute for Work and Health. There's a lot of risk of social isolation when you're doing the shift, say on like an ongoing basis, right? Because your friends and family are not around in the middle of the night when you're working, right? Unless they live on the other side of the world. But generally speaking, you don't have anyone that you can connect with when you're up and about other than your colleagues at work. So kind of developing those relationships, having good communication is probably also part of the design of making night shifts and shift work better. So that's my experience with night shifts. I do not recommend them on a regular basis. There's definitely a lot of challenges around sleep and health effects with long-term night shifts, and definitely impacts on your social network and connecting with people. So it's not ideal for quality of life for sure, but it's definitely doable. And in order to do that, you need organizational support and the facilities that are available for you to rest and exercise and rejuvenate during your breaks. But you also need to look at your own environment and what can you do to make that better, whether it's like bringing in things at work that give you comfort and help improve that environment, and also improving your home environment for daytime sleeping. So for example, like getting the blackout blinds and having a face mask and getting those earplugs that are going to block out the construction noise, or at least, muffle it in my case because of where I live and there's construction everywhere in downtown Toronto. Feel free to share your experience with night shifts, because obviously my experience is super limited right now, and I will be getting more experience in this area. And I could always use your advice if you have any to provide. Like, how do we make shift work easier, better? How do we design it so that we can have better experiences and take care of our health? See you next time.
Thank you for joining us on The Edge. If you enjoyed this episode, please share it with others or leave a comment or rating. Stay tuned for more episodes of On the Edge of Health and Design.